We continue with treatment principles, the root and manifestation. Before reporting the case history for this episode, we should discuss briefly the pathology of severe metorrhagia, which is defined as heavy and irregular menstrual bleeding, called penglu in Chinese medicine. There are two basic causes of heavy and irregular menstrual bleeding. Either deficient qi fails to hold blood, which leaks out, or heat in the blood pushes the blood out of the vessels. In the first case, heavy bleeding will be accompanied by general symptoms and signs of qi deficiency, such as tiredness, pale face, shortness of breath, poor appetite, loose stools, pale tongue, and empty pulse. When bleeding is due to blood heat, there will be general signs of heat, such as a red face, a feeling of heat, thirst, insomnia, a red tongue, and a rapid overflowing pulse. A 36-year-old woman had been suffering from chronic menorrhagia. The bleeding was so irregular and constant that some months she did not know when her period occurred, as she was bleeding every day. She presented with general symptoms of qi deficiency, such as a pale and sallow complexion, tiredness, a weak voice, loose stools, and a weak pulse. It was therefore concluded that the bleeding was due to qi deficiency, and she was treated by tonifying qi. This produced no results. The diagnosis was reassessed and was discovered that she often felt thirsty, her cheeks were occasionally flushed, her tongue had a slight redness on the sides, and her pulse was very slightly rapid. It was therefore concluded that the original diagnosis was wrong and that the bleeding was actually due to blood heat. When the treatment was changed by cooling blood, this produced immediate results. If the bleeding was due to blood heat, what are we to make of her qi deficiency symptoms? What had happened was that the qi deficiency was actually the result rather than the cause of bleeding. In cases of heavy prolonged bleeding, the chronic loss of blood induces a deficiency of blood. As blood is the mother of qi, this will eventually induce a qi deficiency. In this patient's case, therefore, qi deficiency was a manifestation rather than a root, as follows. So, bleeding causes blood deficiency, that is the manifestation of the blood deficiency. Then blood deficiency causing the qi deficiency, that is manifestation of the qi deficiency. Why do we need to identify the root? In the course of a disease, the clinical manifestations can be very numerous and complicated, and sometimes contradictory. Different clinical manifestations will appear and develop in the course of a long chronic illness. They may combine with superseding acute symptoms. Interior conditions may overlap with exterior ones. Deficient conditions may coexist with excess ones. Cold can coexist with heat, and so on. Identification of the root, which need not be a single one, but could be a multiple one, allows us to understand and unravel the numerous clinical manifestations to see the underlying pattern and decide on the principle of treatment according to the condition of the patient and the character of the diseases. There is a saying in Chinese medicine, to treat a disease, find the root. This succinctly summarizes the importance of always tracing the clinical manifestations back to their root in order to treat a disease. This is because, generally speaking, the root is the primary aspect of the contradiction. That is, it is generally primary in relation to the clinical manifestations. As the root is primary, treatment of the clinical manifestations is usually carried out by treating the root. Thank you for your attention.